Hello, Dr. Zeighami. Thank you very much for your time today. I am Salman Sangi, a student at HEC Montreal, and I would like to ask you if you can introduce also yourself, and we go to the next questions.
Hi, Salman. Thanks for having me. It's a pleasure to be here. I am Ali Zeighami. I'm a research scientist at CHUM. So it's the research center of Hospital Center of University of Montreal, and I'm a lecturer at UCAT. I'm teaching orthopedic devices, design of orthopedic devices at UCAT University. I have a PhD in engineering. My background is biomedical engineering, and a couple of years ago I obtained my PhD from ETS. And right now I'm involved with developing new technologies for a couple of companies, doing the research, doing the pure research, applied research, and then trying to reach to the companies and come up with the new innovations which people can feel in their day-to-day lives.
Thank you very much for the nice introduction. So actually, this interview is part of the one course that we have, Globalization, Industrial Dynamics, and Economic Geography. And it's actually related to the presentation that we will have regarding the, let's say, life science and health technology cluster, and the dynamics that we have in this cluster actually. So I would like to ask the first question regarding the interrelation between the technological innovations that you are doing and you are applying actually in the medical sciences. Can you explain to us how it works actually?
Right. So a lot of new technologies which we see today, they start their lives somewhere from like applied researches which is conducted at universities, and CHUM, being a living lab, is a very active lab in which I've been working. It's been a couple of years there, and then we really oriented towards developing technologies for the industry. So I've been affiliated to ETS, and well, we always try to develop new technologies for the industry. And there's gonna be like a couple of use cases which I can tell you about. So one of them was actually started during my PhD studies, and it was a collaboration with a orthopedic lab with a company which is called Medicus, and during those results we came up with some interesting clinical finding, very clear and understandable results for clinicians. And then we were actually approached by this company, and our findings was quite interesting in a way that they could apply that in the design of some orthopedic device which they were really trying to design and optimize for decades, I would say. And it was like a knee orthosis which was designed for osteoarthritic patients. So at all the steps of this project, we really tried to involve our industrial partner, and that was one key success to this specific project. So they were really involved from the very beginning of this journey, like this research, this academic industrial journey, and we could really communicate in a very, very efficient way. And all this, like our findings, our clinical findings, found itself in an innovative design of that orthopedic device, which was then patented, and this product was commercialized. And we could also do the follow-ups, do all the tests, and see the impact of that in improving the life quality of these osteoarthritic patients who were really suffering from a lot of pain, excruciating pain, and it was too early for them to undergo surgery. So we could help them in a way that they could gain more independence, they could feel less pain, and they could rely more on themselves to do this, to do their day-to-day activities. So this project lasted for a couple of years, but then now it's a product which you can find in the market, and that was one of the successful projects which we conducted in collaboration with university.
So thank you very much. So as far as I understand, then you have developed, let's say, one research innovation in the university that can be applied actually in practice and in the medical clinics. Have you actually collaborated with any company here, for example, in Montreal, that adapted with your innovation and they welcomed you actually in their clinic, for example?
Right. So there is a other aspect of this clinical innovation is that, well, nowadays we see a lot of innovations existing, and they're coming. Like there is a flood of new technologies coming to the market. But one problem which we face is making sure that these technologies, like the best of them, are adopted by those who are actually in contact with the patients and are in practice, doing the practice, and apply these technologies to improve the life quality of people. So this really starts during the education. So when we are training our healthcare professionals, we're going to make sure that we really transfer this knowledge, this know-how, how to use these technologies. Otherwise, they're not going to use that, and they're not going to be able to get the best of these technologies and using them in their practice. So as I said in the beginning, I also am a lecturer at the UCAT. So I teach two courses related to the design and biomechanical analysis of orthopedic devices. And one important aspect of that is those healthcare professionals, which most of them have years of experience in the industry, and they come like to push the a little bit like their knowledge further and absorb new technologies and use them in their practices. They're not necessarily very familiar with new technologies or how to use them or when they can use them the best. So what we really try to include in the curriculum of those courses, like in the agenda of our courses, and it was like done during a lot of conversations, a lot of discussions, not only with the companies but also with the students themselves, and what are the real needs, how they want to really take advantage of these technologies. So we try to transfer these technologies and show them how they can use them. So well, actually, to those healthcare professionals, I selected a couple of let's say companies and technologies which they can use in order to a little bit get away from the traditional ways of fabricating medical devices, orthosis, prosthesis, which is very good, which has been on the market for a couple of years, and moving forward to technologies which is really personalized, which is really tailored to the specific needs of every patient. And we cannot get there unless we have a good knowledge of new technologies like 3D printing, additive manufacturing, and how we can design orthopedic devices for every single patient. So they're gonna need, apart from the scientific basis of the design and everything, they need to learn a little bit like the engineering side of that. So those people we try to include in their course, like some demonstrations of new softwares and the principles of additive manufacturing. So one software, let's say, which is internationally like globally used, is from a company which is called Rodin Catte, a French company, international French company, where they develop softwares in order like to 3D design an orthopedic device in a virtual environment. And then they also need to learn softwares related to 3D design, like Onshape or SolidWorks. That was also in their course. And other softwares like Mesh Mixer from Autodesk, which they try like to democratize the use of 3D printed orthopedic devices globally. And with all those, they really started to gain expertise in order to design some device in 3D, know how they can do the 3D printing, or like ask a company like to do the 3D printing for them, and then come up with a really unique and personalized design, which is really useful for the very same patient they're treating.
Thank you very much. It was very comprehensive, let's say, explanation. Doctor, like the last question, I would like to ask your opinion about what are the fundamentals, or what are the reasons that makes Montreal so attractive for this kind of life science and health technology business. If you can just shortly nominate some reasons.
Yeah. Well, I would say first being resources, like human resources. We got 4 or 5 large universities and abundance of experts and high quality university graduates. The second being the very good access to the North American market, making very appealing, especially for European companies and firms who want to outreach to the North American market. I would say second is being the cost of running the business, which is quite reasonable in Montreal compared to other large North American metropolitan areas. Also, I found the business regulations here are quite business friendly. And the last is being the established foundation of diverse tech fields. So from medical sciences, IT, the engineering part of that, AI, we have a good foundation here in Montreal, which makes access to expertise quite easy.
Thank you very much, Doctor, for all these efforts that you have made in your studies. I don't have any other, let's say, questions for the moment. If you have the last comments, let's say, I would appreciate if you make, and thank you for your time for having this interview with us.
Thank you very much. So that was pretty nice what you're trying to do, and well, I hope like we can like it's really important that we can also optimize the process, because it's not always about like what technologies exist, what technology doesn't exist. So it's not always an engineering thing. I think what you're trying to do is like kind of closing this loop and finding the gaps and optimize the process, like having a more global overview of the whole thing. And this is really sometimes you feel like that aspect is missing, or is kind of ignored in a way that it needs some serious modifications and optimizations. Thank you very much.
Thanks to you. Thank you very much for your time. Okay.